Hi everybody, I'm Craig Harris. I'm the Executive Nurse and Director of Safeguarding for Manchester Health and Care Commissioning, which is a partnership between the City Council in Manchester and Manchester Clinical Commissioning Groups. So I've been a qualified nurse for 18 years now, and I've been in the NHS for 21 years. And that all coincides with not only the 70th anniversary of the NHS, but also my celebratory 40th birthday that was in April this year. So what I wanted to do was talk a little bit about my role and my experiences and how important the NHS is to me, and more importantly nursing and my identity as a nurse. So I'm a Wigan lad. I grew up in Wigan, went to college, did dance and drama, so nothing to do with psychiatric nursing, and then decided to have a change of career and became a qualified mental health nurse in 2000. And worked primarily on the wards in A&E, did some work in maternity, and then did a lot in relation to forensic services. One of my passions, and one of the things I really enjoy doing now, I love about my job, was I worked with children and children in forensic settings. So that really set me up, I suppose, for a lot of the future. I came to Manchester in early 2004, so I'm in my 15th year here in commissioning, and I've seen a whole range of different reconfigurations, reorganisations and changes. And I can honestly say now that I think I'm in a role that really enables me to enact change and hopefully improve outcomes for everybody in Manchester. And I'm really fortunate to do a job that I love to do. So first and foremost, I'm a nurse, and I think if you were to cut me in half, you would see that I'm a nurse through and through. I've been passionate about mental health services for almost 2 decades now, and that's really what got me into nursing in the beginning. A ward manager, when I was doing a student placement, sort of told me to stop wasting my time on the acute wards in medical settings and come and spend time in a mental health setting. And once I started, I never stopped. And that's something that's been a golden thread throughout my career. So I'm the executive lead now for mental health, and very proud of a very long and difficult journey we've been on in Manchester to improve mental health services. And all that through my clinical commissioning role as a nurse. And I think that's really important to remind people that not all nurses work in hospitals or work in communities or work in clinics. I've been an executive nurse now for 5 years, and I've probably made the biggest impact in my career in my executive nurse role, being able to shape policy and change the direction of travel for health and social care services, primarily being a nurse and focusing on what's important for nursing. And I'm doing a big piece of work now with a lot of our nurses about how we recruit to new nurses, how we develop and design new nursing roles, and how we have a fit-for-purpose NHS. And that really leads me on to the NHS, the 70th anniversary of the NHS, and I think it's one of our most amazing institutes in this country. And I think if you look around globally, you know, we're looked at as a leading health and social care sort of institute within this country. I think it's something we should all be extremely proud of. And I know the NHS gets lots of bad press, and I know there's issues about funding and about recruitment, but actually I think for most people who do experience the NHS, they get a really good service. And I think, you know, we are trying our best to improve despite all of the environments that we work in and all the challenges. And I think nurses are at the heart of that biggest workforce in the NHS, and I think it's something that I was lucky enough to adopt an amazing little boy, and every day he reminds me about what's important in life and what I'm here to do. Even falling over, coming out of school the other day and scraped his knee, and I said, "Come on, let me have a look at it, I'm a nurse," and his response was, "No, you're not a proper nurse, you don't wear a uniform." So, you know, from his perception, even though I consider myself a nurse, I think that, you know, because I'm not working with a uniform on, he didn't see me as a nurse, and it made me really think about the perception of nursing and what's important to the public and out there. So I believe, you know, we are entering a whole new uncharted territory with local care organisations, the pressures on the NHS, how we're trying to improve not just systems and processes but the quality of care for people. So nurses come in all shapes, sizes and forms, and we don't always have to wear uniforms and we don't always have to work in hospitals, but it's really important that the identity of nursing is preserved throughout whatever the major transformational changes are. So that's it really. What I would say is if you're thinking about nursing, don't just think, go and have a look for yourself, go and see what it means to you. It's not for everybody. I love it. I thought I was going to be a dance and drama actor at some point in the future. That wasn't my destination, it wasn't what destiny had in store for me, but I can honestly say I enjoy every part of my job and what I do, and I've got lots more to do in my career, in fact another 20 plus years I think, and I want to make the most of it, so that's all from me. Thanks.